Hardik Parikh. I am DM gastroenterologist working at Punch Hospital, Manipur. Today we are going to hear about certain disease like gastroesophageal reflux disease, acidity. In common man's term, it is called an acidity. Now, what is acidity? Acidity means there is when the stomach forms some acid and there is a reflux of acid. Acid goes from the stomach to the food pipe. Then it is called as reflux disease. When it occurs multiple times, then it is called as gastroesophageal reflux disease. What are the common symptoms of acidity? Acidity causes the patient will give a sensation of either heartburn, burning sensation in the throat. Patient can also say there is reflux occurring, the food getting regurgitation into the mouth. Sometimes it causes bitter taste in the mouth, chronic cough, chest pain. Is there any hidden signs and symptoms of the acidity? Sometimes acidity can mimic chest pain, but every patient with chest pain should be evaluated for their cardiac cause rather than suspecting them for acidity. Why doesn't anti-acid medication doesn't work for a long time? The anti-acid medication which is available over the counter are antacids. They work for only 4 to 6 hours. Other medicines which are also available, which also work for 24 hours. Does this acidity is a short-term or a long-term disease? This is a long-term disease. It's a chronic disease where it frequently reoccurs on the stoppage of the medicines. But in today's era, there are effective medications available where patient can have a good control of the symptoms after taking the medicines. Does stress can worsen my symptoms? Any diet can worsen my symptoms? Yes, stress and diet can worsen the symptoms, though they are not found as a etiological factor for gastroesophageal reflux disease, but really they can worsen the symptoms. Patients should monitor the diary and diet diary, which can say which diet can worsen their symptoms. Is fasting can worsen my symptoms of gastroesophageal reflux disease? Yes, definitely, because fasting leads to accumulation of more acid into the stomach, which can worsen the symptoms of gastroesophageal reflux disease. How should I know that I am suffering from acidity? Somebody who is experiencing burning sensation once a week may not need seeking attention to the physicians. But if these symptoms occur troublesome multiple times in a day or multiple times in a week, it is recommended that to have more than 2 times a week. This patient should consult either a physician or a gastroenterologist for these symptoms. Does acidity can lead to serious outcome? Yes, acidity can lead to serious outcome, but it is in very small number of patients. Not every patient will have a serious outcome. In rare cases, it can cause damage to the esophageal mucosa, which can lead to a condition which is called Barrett's esophagus, which can come into an esophageal carcinoma. But this incidence of this condition is very minimal, and every patient should not worry about having this condition. When should I concern about my symptoms to a doctor really? When somebody is experiencing repeated episodes of burning and now started developing difficulty in swallowing, or there is episode of bleeding through the mouth, or he or she has symptoms of anemia, weakness, fatiguability. Any patient who has recent onset of the symptoms, where its symptoms starts after the age of 40 years, should be concerned, should visit a physician for this symptom. How this clinical condition, gastroesophageal reflux disease, is diagnosed? Normally, when patient takes medicines like antacids or proton pump inhibitors in a double dose, and there is a relief of symptoms, then it usually does not require any further investigations. But if despite of taking these medicines for a month, if there is a recurrence of the symptoms, then patient should undergo an endoscopy check. And any patients who have symptoms which I described earlier, any dysphagia, weight loss, anemia, this patient needs to undergo an endoscopy for diagnosing the complications of gastroesophageal reflux disease. What are the treatments other than the antacid or proton pump inhibitors? Does dietary lifestyle modification helps in the disease? Yes, obviously and definitely. It should be the first step for the treatment of gastroesophageal reflux disease. Which dietary lifestyle modification? One should reduce the weight if they are overweight, that is the first step. Eating frequent small meals in a day will reduce the distension of the stomach, will reduce the reflux of acid from the stomach into the food and helps in controlling the symptoms. If somebody who is consuming smoking and alcohol should definitely avoid to smoke and intake of alcohol. Other lifestyle modifications like wearing the loose clothes, and if you take a meal at least 3 to 4 hours prior to going to a bedtime is beneficial for treating the gastroesophageal reflux disease. What is the any other long term treatment for this disease? Taking medicines usually controls the disease. Some patient might need to take these medicines for a longer time. It should be taken in minimal effective dose, which is least effective dose. Either you are taking 40 milligram of pantoprazole, rabiprazole, omeprazole in 2 times in a day, and if somebody has a relief of symptoms only with 40 milligram of dose, he should be taking 40 milligrams in a day. In summary, the antacids which are available that are very effective for short term relief, and other proton pump inhibitors and medicines like ranitidine can be useful for long term relief of the symptoms, and lifestyle modification will reduce the need for these medicines.